Hi, my name is TJ Waggoner. I'm the founder of Waggoner Diagnostics, a medical device company that specializes in color vision testing. And today we're going to be talking about something a little bit different, and it includes why is color vision testing so important in healthcare? And I'm really excited to be talking to Quint Studer today. Quint, can you tell us a little bit about your background?
Well, I was in healthcare a long time, over 3 decades. Worked with over 1,000 hospitals in the United States. Of course, many people know me as the founder of StuderGroup, won the Malcolm Baldrige Award. Of course, many people know books, basically geared toward improving the culture of high performance, which means how to get employees and doctors with you, and of course then how to improve clinical outcomes. That's why everybody is in healthcare, I think, too. That's why everybody is outcome we can for our patients. And so it's been fun. I have unbelievable great respect for anyone that's in a healthcare profession, because they go through a swing of moods that many people can't go through. And I think that's what got me. Our first mission statement at StuderGroup was how to make a great place for employees to work. And then it was how to create a great place for patients to get care, physicians to practice medicine. Now I resigned from sort of StuderGroup a couple of years ago, but I'm still very interested in clinical outcomes in healthcare.
Great. Well, you mentioned Baldrige Award winning, and recently I actually had a discussion with the Chief Human Resource Officer of a Baldrige Award winning hospital. And I asked her, I said, I explained in the importance of healthcare, and I said, of color vision in healthcare, and I said, can you ask some questions that, what do you need to know? How can I help you understand the importance? As a color vision deficient or colorblind individual, I understand it. But somebody who has normal color vision doesn't really get it. So she brought up a couple questions, and I wanted to go over those with you today, if that sounds good.
Yeah, and it's interesting because I want to add for people that say, well, Quint, how did you get interested in this? Of course, when I was president of Baptist Hospital here in Pensacola, Florida, Pensacola, Florida is a Navy town. Any flyer anybody that's ever flown for the Navy and Marines has been trained in Pensacola, Florida. And it first caught my eye that, because I always thought if you were color deficient or colorblind, you got to know this stuff, and you have to know it. Well, I found out that wasn't true. That wasn't true at all. And when it first hit me is when I would learn that people were here, they were accepted into the aviation program almost, and they did not know that until the Navy or Marines said to them, you can't do this because you're colorblind or color deficient. They were unaware of it. So I thought it was fascinating. Then I learned it's not unusual for someone that has a color deficiency to not know it, or certainly not know the extent of it. Now, if somebody shouldn't fly a plane, should somebody be doing surgery? Should somebody be taking care of patients? And when you look at it, again, we have people in healthcare that might not know it. Now, hopefully we can give them some ways till they can compensate for it. So that's what really caught my interest, is being in Pensacola, realizing that people can't do it. And then, of course, then as you start seeking, well, how do you find out if your employees are color deficient? You start, like I've always done, you start diagnosing and looking for resources. That's, of course, what led me to you.
Well, thanks so much. Yeah. Well, you're right on the dot, because 20 to 30% of individuals don't know they have a color vision deficiency. Right. And recently I was in an ophthalmic conference, and I was with a 35-year-old, and I said, yeah, let's take a test. He goes, oh, my wife always says I'm colorblind, because I dress in a unique way. I miss this, I miss that. And I said, well, we'll go ahead and set the record straight if you're colorblind or not. So we gave him a test. 35 years old, never been diagnosed as color vision deficient. Sure enough, a mild deutan, or mild green week. And he had never known. So 20 to 30% truly do not know this. So it's really important for that testing.
And then to what extent, for example, if you're an ER nurse and you might have some of it, you might not know the severity of a burn. You might not know the severity of a burn or a sunburn. You might not know if a mole changes colors. So as a clinician, you want to know these things, and you might miss them, and you don't want to miss it. And I think that the other thing that's important, because as you know, Joint Commission doesn't require that you test all your employees for color deficiency. However, they do say that you should make sure you know which employees are color deficient. Well, if an employee might not know it, but you're supposed to know it, it's sort of bizarre. It sort of doesn't fit. But now the College of American Pathologists do say that you have to test to know who's color deficient and so on. And I think it's fascinating because, my whole background is if you don't capture the hearts and the minds of your employees, you're never going to get anywhere. Well, one of the things we find out, how do you keep employees? You keep employees by showing an interest in it and showing, I think, you care about them. Okay. So I've talked about, I'm a big believer in the stigma of mental health. If a nurse or any caregiver or anybody in healthcare, support caregivers, is going through a rough depression, that could impact their decision making. So of course you try to get them help, which could be an employee assistance program. My daughter-in-law is a nurse, and she's a nurse on a med-surg unit. And that's really good because she grew up on a farm. She's extremely strong. Now, I say that because she does a lot of lifting on her unit. But if she hurt her back, her employer would want to know, because her employer then wouldn't put her in a position where not only would she hurt herself more, but she could hurt a patient more. So when we look at employees, most great healthcare organizations, I believe, their desire is to make sure they're doing everything they can to keep their workforce as healthy as possible. This is, I think, something they miss that could be a big win for them. Because when you look, if I have 2,000 employees and I test for color deficiency, I'm going to have more men than women. But the reality is I'm going to find some people. And when I can find that person and say, but let us make some adjustments for you clinically. Mm-hmm. Let us help you possibly why this is causing you even issues at home or issues at work. Man, I think, and it's such an inexpensive thing. And it's so easy to do. And I think sometimes when it's inexpensive, easy to do, we don't do it because we don't think it has the value. But I do think this is one of those, I care about you and I'm investing in you wins that everybody gets with the employee. Most importantly, it can help provide better clinical care.
Yeah, you really did hit the nail on the head there because 8% of men and 0.5% of females have a genetic deficiency. I am a severe green weak individual, okay? And I myself have issues. So when I get a sunburn, I don't know I'm actually burning until I do what I call the touch test. I touch it, I see the contrast and go, oh my gosh, I'm getting burnt. It's already too late. Rashes, gross hematuria, things of this nature. And one thing that is really important is, what about stage 1 pressure ulcers? The stage 1 pressure ulcer on individuals who are maybe, let's say, a little bit more tan or have darker skin, there's not a lot of contrast there. So these can be missed.
Well, not only are they missed, but they're also, not that this matters, but it sort of does. There are certain things in health called never events. And never events mean they should never happen. But they do because we count them. And of course, the government or any insurer doesn't want to reimburse for things that they think shouldn't happen. So if you miss something that could prevent a pressure ulcer and the patient gets it, one, it causes you, of course, clinical issues. But also it's a non-reimbursable at this time or reimbursed less. So again, I'm a big believer that getting employees healthy counts. And it counts not only for the employee, but it also counts that's why when we wrote the article together, mm-hmm. I was interested in this because, I was always looking for wins. As a hospital CEO, we get enough losses. Probably anybody out there gets losses. I'm looking for wins. And if I can, one, provide our employees with an assurance that they do have the ability to make right decisions when it comes to one of the big expenses years ago. I remember we bought colored monitors for our ICU. So here we are trying to do it so it's easier. And again, I need to then help the employees make sure, because they don't know they're missing it. So I just think this is one of those inexpensive things that we can do that one builds an employee. What's the worst that can happen? We know we don't have a problem.
Exactly.
The second thing that's going to happen if we do, it's something that we can deal with and adjust and help all of a sudden it clicks. That's why I'm missing that. That's why this is happening.
And you said it right there. If you're a color vision deficient nurse or color vision deficient doctor, we still want you practicing, but we want you to develop coping mechanisms to say, you know what, I can possibly miss this. What can I do better? Let me get a second opinion from another nurse.
Right. If I have a scribe with me in the ER and they know there's certain things I might not catch, I can tell, can you be on an extra lookout for this? It's very simple, and that's the thing. If you look at all the things that can challenge a caregiver, finding that in aviation they don't get that second chance. They can't say bring a scribe on the plane, so people can lose a career. So of course they're afraid of it. But in healthcare they don't have to. We just can provide coping skills and so on. So why don't you tell them about what they can get if they'd like to, because I think the paper might be of interest to people and it's an easy read.
Absolutely. So Waggoner Diagnostics provides several solutions for testing of color vision. We have an online solution that integrates into learning management systems. So for very large healthcare systems, it's an efficient and effective manner to get that done. However, if you're a small organization, we just want you to test their color vision. If it's through us or not through us, it's an important thing for patient outcome, to improve patient outcomes, right? And also, you mentioned helping the employee. Well, acquired deficiencies affect 15% of the general population. And these acquired deficiencies are caused by diabetes, glaucoma, multiple sclerosis, and a lot of other diseases that cause optic neuritis. So not only are we creating a better patient care or patient outcomes, but we're also able to say, hey, here's a red flag right here. We might need to send you to an optometrist or an ophthalmologist to take a look at this to see what else is going on.
So if I'm a CEO, which I was for many years, it's all going to sound great, but somebody's going to say, what's it cost?
Right.
So what does, I have an employee, what does it cost about per employee to do a screen?
Well, it really depends. If you're only onboarding 50 employees, we don't want to give you the online solution. If they're all going through one thing, we'll give you a $195 book that you can put in there in your HR room, have them screen, and move on.
That's it?
Absolutely.
For like $195?
$195 for the book. Now, let's say that you want to do 5,000 employees. Now we're looking at a couple dollars, but we integrate into your learning management system. You don't have, it's all stored in your LMS, so when you get audited by Joint Commissions or CAP, and I know that it's not required by Joint Commissions, but it sure as heck looks nice.
Well, again, I wouldn't care personally if it was required or not required, because if you're doing things only because of Joint Commission, it's not right anyway. I want to do this as a hospital CEO because, number one, I want to make sure my patients get the very best care. And if they've got somebody with a color deficiency, they might not. Number two, I want to save my employees. I'm not doing this to hurt my employees, because I imagine if I got a color deficiency, I know I've struggled a little bit at times. I know I might have missed something a little bit at time, but I don't know it. Well, once I know it, then at least I still feel bad I might have missed something, but at least I know why. But more importantly is the coping skills. These are things that you don't lose your career. You actually can have simple coping mechanisms that can be put in place in a world of tight employees. Tight employee to keep them, competition for employees. I think we really want to make sure we attract our talent and keep our talent. And again, Gallup says the number one thing a person wants in a place to work is, do you care about me as a person? Another thing they want is, are you invested in me? Well, if you can hit, I care about you, person, I'm invested in you for the price that you're saying it is, which I think in healthcare the challenge is it's so low we're going to wonder, is it any good? You might have to raise your prices a lot. But the reality is it's just a win-win. And I think what gets missed, sometimes sadly if it's not required it gets missed. But I don't think people miss it on purpose. Until I was aware of a Navy pilot in training, would not know it. Until I met you, it just didn't click. So I just think it's a matter of awareness. And once people are aware, I always say, once the light goes on, you can no longer not do it. Like whether it's an aspirin within 20 minutes, whether it's a call back to a patient, whether it's making sure the peers interview the peers. Once I learn these things that will provide better care and a better culture, I can no longer not do it. I believe once somebody understands how easy it is to test for color deficiency, and it's inexpensive, it's easy, and the positive outcome you have from doing it, I can't believe anybody that has strong values would not want to do this.
Right. Well, Quint, thank you so much for your time today. If you're interested in reading the PDF and the article that we wrote together, you can go to www.waggonerdiagnostics.com, learn about the importance of color vision testing in healthcare, And thank you so much for listening and trying to improve patient outcomes.